All right, let's be straight with each other, gentlemen. If your health, self-confidence, and future as a man truly matter to you, this is one video you should not skip. And here's why. There are 10 habits many of you may be doing every single day that quietly and consistently harm your erections, reduce sensitivity, and can seriously threaten your long-term sexual health. I'm not here to frighten you. I'm here to give you control. Because when you understand what to avoid, you can actively safeguard your performance, your confidence, and your self-respect for years to come. Before we get into the list, do me a quick favor. Tap the like button so this message reaches more men who need it. Subscribe to the channel if you haven't yet, and tell me in the comments where you're watching from today. I genuinely enjoy seeing men from around the world stepping up and taking responsibility for their health. If you're new here, I'm Dr. Ella. I'm a board-certified urologist, and for the last 7 years, I've focused on men's health and sexual medicine. I've helped thousands of men struggling with erectile dysfunction, low testosterone, and prostate-related concerns. I can say this with complete certainty. Small adjustments can lead to powerful results. Here's something most men don't fully understand. Your penis acts like an early warning signal for your entire body. When something is off, whether it's circulation, hormones, or even heart health, your erections are often the first place it shows up. A weaker or disappearing erection isn't just bad luck or something you should brush off as aging. It's your body sending you an important message that something deeper needs attention. Ignore that signal, and you could miss the opportunity to stop serious issues like heart disease or even a stroke. Listen to it, and you may be able to reverse the problem entirely. So let's break this down step by step. These are the 10 things you should avoid at all costs, and just as importantly, what you should do instead to stay strong, healthy, and confident. Stay with me until the very end, because I'll also share a safe, natural option that can help support stronger erections without depending solely on prescription medications. Mistake number 1 is ignoring changes in your penis. This ranks first because it is the most important. Never dismiss changes in how your penis responds. From a biological standpoint, the arteries in the penis are extremely small. Your penis acts like the body's early warning system. When erections become weaker, it often signals that blood vessels are starting to narrow. Because penile arteries are so tiny, circulation issues appear there years before they affect the heart or brain. That's why men with erectile dysfunction are statistically at higher risk of a heart attack within 5 to 7 years. Emotionally, this connects to dignity and fear. Ignoring these signs means losing a valuable chance to protect not only your sex life, but your life itself. Practically, here's what to do. If you notice a lasting change, don't shrug it off. Take it seriously and speak with your doctor right away. Mistake number 2 is depending on unsafe home remedies. I've witnessed it all in the clinic. Men experimenting with apple cider vinegar, makeshift constriction devices using rubber bands, or aggressive stretching methods. From a biological perspective, this leads to tissue injury. These approaches can cause tiny tears, nerve damage, scar formation, and in some cases, permanent erectile dysfunction. The human body is not simple. If you choose to use aids like constriction rings, they must be medically approved and include a proper safety release. We've treated men in the emergency room who required power tools to remove dangerous, non-medical devices. Emotionally, it comes down to risk versus reward. Wanting a solution should never put your body in danger. Practically, here's the takeaway. If a so-called remedy sounds extreme, it probably is. Look for evidence-based options or consult a urologist instead. Mistake number 3 is neglecting proper hygiene, either cleaning too little or too much. It may seem simple, but this is one of the most frequent problems I encounter. There are 2 extremes. First, the undercleaner. Biologically, if you're uncircumcised, it's essential to gently pull back the foreskin, wash underneath with a mild, non-drying soap, rinse thoroughly, and pat dry. Failing to do this can lead to smegma buildup, which may cause infection, inflammation, and discomfort. Then there's the overcleaner. Biologically, don't overdo it. Strong soaps and vigorous scrubbing remove protective oils and irritate the skin, making sensitivity worse. Practically, here's what to do. Keep hygiene simple, gentle, and consistent. Use a mild, pH-balanced soap or just water. Caring for your skin this way keeps it healthy and comfortable. Mistake number 4 is ignoring pain, bleeding, or lumps. This is a major warning sign. Experiencing pain during sex, seeing blood in your urine, or noticing a lump or sore is never normal. Biologically, these are serious red flags. They indicate that your tissues may be under significant stress and could point to infections, kidney stones, or, in rare cases, cancer. Emotionally, it's about facing fear. Ignoring these symptoms delays potentially life-saving care and lets anxiety and worry grow in your intimate life. Practically, here's the step to take. If you notice anything unusual or painful, get it evaluated immediately. And if your primary care doctor makes you feel judged or dismissed, find someone who treats you with respect. You deserve care without shame. Mistake number 5 is taking unnecessary risks during sex. Confidence and safety must go together. I can't stress that enough. Penile fractures are real emergencies. Biologically, this happens when an erect penis bends sharply against something solid, usually during certain positions. The outer tissue, called the tunica albuginea, tears. There's a sickening pop, immediate pain, severe swelling, and bruising. This is often called eggplant deformity. If it happens, go to the ER immediately. Practically, here's how to prevent it. Use plenty of lubrication. Lack of natural lubrication isn't a sign your partner isn't interested. It could be hormones, medication, or stress. Generous use of lube protects both partners, reduces friction, and helps you maintain control during movement. Mistake number 6 is overheating your testicles. They are outside the body for a reason. They need to be cooler than your core for healthy sperm and optimal testosterone production. Biologically, heat can cause damage. Long hot tub sessions, sitting with a laptop directly on your lap, or keeping your phone in your front pocket can raise the temperature. This heat impairs sperm production and lowers testosterone levels. Emotionally, it's an invisible threat. Subtle drops in energy and desire often show up before you realize the cause. Practically, take action by placing your laptop on a desk, using a pillow, and keeping your phone in a bag or jacket pocket. Cooler is always better for your long-term health. Mistake number 7 is gripping too hard during masturbation. One of the most frequent issues I see, especially in younger men, is called death grip syndrome. Biologically, it desensitizes. Applying excessive pressure trains the nerve endings in your penis to need extreme stimulation to reach orgasm. This physically dulls your sensitivity, making partner sex, which involves gentler, varied pressure, less satisfying. Emotionally, it leads to frustration. You may feel disconnected from your partner, thinking they aren't doing it right. Practically, here's the fix. Lighten your grip, use lubrication, and consciously retrain your body to respond to softer, more natural sensations. Expand your pleasure vocabulary. Mistake number 8 is smoking. If there's one habit guaranteed to harm erections and overall longevity, it's smoking. Biologically, it destroys nitric oxide. Nicotine and other chemicals in smoke damage the inner lining of your blood vessels, the endothelium, reducing nitric oxide, the very signal your body needs for an erection. Smoking literally chokes off circulation and significantly raises your risk of bladder cancer. Emotionally, it leads to future regret. It drains your energy and confidence while replacing them with long-term health worries. Practically, the solution is simple. Quit. Completely. Quitting protects both your sexual performance and your long-term health better than almost anything else. Mistake number 9 is beating yourself up over an off day. Many men mistakenly tie their self-worth to performance, but here's the reality. Every man has an off day. Biologically, stress constricts. When you spiral into worry and anxiety, your brain triggers the fight or flight response. Stress hormones like cortisol tighten blood vessels, the exact opposite of what's needed for an erection. Emotionally, it becomes a cycle of failure. Punishing yourself creates a toxic loop of fear and frustration that could be entirely avoided. Practically, here's what to do. Remind yourself that your value isn't defined by one moment. Talk openly with your partner or your doctor. Don't carry the anxiety alone. Your partner cares about connection, not perfection. Finally, don't stop using it. The rule, use it or lose it, is very real here. Biologically, erections keep tissue elastic. Blood flow delivers oxygen-rich blood to penile tissue, preserving sensitivity and flexibility. Without regular engorgement, scar tissue can form, sensitivity declines, and even size may slightly decrease over time. The maintenance program is natural. Nocturnal erections are the body's way of upkeep. If they stop completely, it could signal deeper problems. Practically, even solo stimulation supports blood flow and tissue health. Remember, intimacy isn't only about sex. It's about connection and care for your body. It's about connection, confidence, and keeping your body in good working order. So, what should you do instead? Protect your circulation. Exercise regularly, eat whole, nutritious foods, and consider supplements like L-citrulline found in watermelon. Your body converts it into nitric oxide, the molecule that signals penile arteries to relax and open, meaning better blood flow where it matters most. I'll share my trusted recommendation in the pinned comment. Keep your hormones in check, manage stress, prioritize sleep, and get your testosterone tested if necessary. Stay safe, consistent, and proactive. Keep hygiene simple, use lubrication, and treat your erections as the vital sign they truly are. Listen carefully. Erectile issues are not the end of your masculinity. They are not a source of shame. They are signals meant to be noticed and addressed, not feared. I've seen men in their 50s, 60s, and even 70s restore not only their sexual health, but also their energy, confidence, and relationships. Small, consistent steps create huge results. Consider this your wake-up call. Respect your body, avoid these 10 mistakes, and you'll be protecting not just your performance in the bedroom, but your overall health, dignity, and future. If this video was helpful, share it with another man who might benefit. Hit the like button, subscribe, and leave a comment below. What's one change you're committing to today? I'm Dr. Ella, and my mission is to help men feel informed, confident, and empowered at every stage of life. Remember, age does not mean the end of vitality. With the right care, you can enjoy freedom, confidence, and intimacy for many years. Take care of yourself. You are absolutely worth it.